talking about snoring, and we're just moving further into sleep apnea, sleepiness, and driving risks. And I actually found a study online which actually mentioned that obstructive sleep apnea is the most common sleep-related breathing disorder worldwide and also in Asia, which is common among middle-aged men and women, about 7.5 and 3.2% respectively. So it's really, really interesting. And talking about extended family and also my dad as well, they're in this category then, Zoe.
Exactly. So that's actually very, very interesting. I'm not entirely sure if you can actually get sleep apnea when you're younger. How about we ask our expert here on the show? He is Dr. HAFARUZI Harun, a consultant internal medicine from UitM Private Specialist Center, who's looking very dapper this morning. I love it. I love it. If you were my doctor, I'd go to the hospital every single day.
Oh, thank you so much. I think that's a compliment.
Of course, take everything as a compliment, doctor. I have to say, we are kind of matching here a bit.
I know, you two are matching. I didn't get the note to wear grey today.
Oops, forgot to send note.
You know what? So anyways, we want to ask you, can you explain to our audience what exactly is sleep apnea? Because we had a brief introduction, or we had a brief explanation where, you know, we just showed that basically it's when you do that, and then, you know, that's what the videos are showing me. But in medical term, what is actually sleep apnea?
Yeah. So sleep apnea is a condition where when you are sleeping, you are actually choking. Your airway is actually blocked. So making your sleep become fragmented. So you're supposed to have a continuous sleep, then you will be fully rested the next day. But because of sleep apnea, the airway is actually blocked repeatedly, right? So then you are choked. So because of this choking sensation, you make this loud whistling sound, thunderous sound at times. So when you wake up, you have sleepiness. You also have headache because you are basically struggling during your sleep. So this is in a nutshell what sleep apnea is all about. So it's a repetitive or recurrent blockage of the airway when you sleep, causing your sleep quality to be significantly decreased, and when you wake up the next day, you feel like as if you are jet lagged all the time.
Right.
But doctor, you know, you said that actually it could be because you're lacking of sleep. But what are actually the causes of sleep apnea? Is there any specific cause?
So the causes of sleep apnea can actually be divided into adult causes and children or pediatric causes. So for adult causes, it's usually obesity. You know, when you are obese, you got a lot of fat surrounding your neck. So causing this to actually fall over, or actually because gravitate, causing compression of the neck when you sleep. You also have sleep apnea because of the structural deformity of your chin. So they call it receding chin, when your chin is actually smaller or deeper inside. You also have sleep apnea when you have too large of a tongue. So we call it microglossia, or enlargement of tongue. So these actually for adult population. So mainly it's obesity related. So my own son, when he was 7 years old, he has huge tonsillar enlargement because of recurrent tonsillitis. So children do suffer from sleep apnea, mainly because of tonsillar enlargement. So he's here with me in the studio right now, but he can be a testament that after the removal of the tonsil, the sleep apnea for him goes away. So sleep apnea in children is a bit tricky because it impairs their academic performance at school.
Oh, wow.
So same goes with us when an adult is suffering from sleep apnea. They have cognitive function decline. So whenever they are driving, their response time, you know, when we're supposed to be driving, we're supposed to be alert and, you know, responsive at all time. But because of sleep apnea, you are not sleeping properly. You get tired easily, so you can't focus when you are sleeping. So therefore, you are at higher risk of developing into or getting into car accident.
Right.
Oh, I see. That answers our question that children also
can get sleep apnea. But it's actually very interesting in how the lack of quality sleep is linked to driving, for this instance, right? So other than that, what are the other impacts of, you know, having no quality sleep essentially?
Yeah, so when you are sleep deprived, either because you don't have enough sleep or when you are sleeping, the quality is impaired. When you wake up the next morning, you actually get tired. You can't focus, so memory memory would actually be impaired. Yeah. So when you are sleeping and you are struggling when you are sleeping, your blood pressure will actually go up. So and then your heart is going to beat irregularly. So the risk of heart attack, stroke would actually be increased if you are sleep deprived or you don't have adequate sleep quality.
Right. Essentially, it's like a car engine. If the car is not properly oiled,
Yeah.
it's not, it's
It
not
will lead
well
to further
maintained.
disaster.
Yeah, it will break down essentially.
Yeah.
So that's actually interesting. How can we tell though if we have sleep apnea? Because let's say for small children, how can we tell, and are the symptoms different from adults?
Yeah. So for children, because they don't usually communicate with us, they don't actually articulate what their problem is. So usually you have to ask the school teacher whether they doze off or they go to sleep at class. You know, they can't focus. The academic performance is reducing. So their teachers usually say that they just simply in their own world.
Yeah.
Yeah. So that's usually for children, but for adults, so they tend to actually fall asleep when they are driving, whenever they are reading a newspaper. When they are in a public space like this, they just simply doze off. So they become excessive sleepiness in the morning. They also get tired every morning. They get morning headache. They snore loudly. So you have to ask their sleep partner, their bed partner, or their family member. So they usually have a large body size where their BMI is usually more than 30 or 35. Yeah.
Oh, wow.
And then for men, the neck size usually when you're wearing a shirt which is more than 17 inches, that is considered as XL or large neck size. So you can actually see from their body habitus that they actually are large in size. So when their size is more than 17 inch for men and 16 inch for women, so this puts them at a higher risk of developing sleep apnea.
Wow, that's so insane.
Yeah, actually, in relation to your last question as well, talking about symptoms, sometimes we don't see them in kids, but sometimes we don't, even as adults, like how you have extended relative and I, even with my dad, we tend to see it as like a normal thing, or they're probably just struggling to sleep or it's just a bad dream, like I've mentioned. So can it actually go away? Can sleep apnea just disappear on its own?
Yeah, unfortunately, sleep apnea is a chronic condition. It's because of your body size. So without treatment, it will not go away on its own. Yeah. So it needs treatment. So to answer that question, it will not get better like the acute illnesses like dengue fever, infection, pneumonia, which can get better after a short treatment. But sleep apnea usually don't get better without treatment.
So what are the treatments? Are the treatments invasive? Is it scary? Because it involves your essentially your breathing pathway, right?
Yeah.
And I know especially a lot of older folks, they're very, very scared, or rather they're just treating it as, oh, tak apa lah, no, it's fine. I'm still alive.
Or people actually don't realize it.
Yeah, or they don't realize it.
Exactly.
So for treatments out there, are the treatments invasive, and how long does the treatment process take?
Right. So that's a good question. But before we go to the treatment, so 80% of those who have sleep apnea, they don't realize that they have sleep apnea. So it's underdiagnosed in 80% of cases. So recent data shows that 30% of adult population in Malaysia have sleep apnea. So if we have 25 million registered voters in Malaysia, so 30% of that is equivalent to about 7.5 million.
That's so crazy.
Yeah.
That's a population of what, a state?
To bring that into perspective, 7.5 million of Malaysians are suffering from sleep apnea, and 80% of those, they don't realize that they have problem.
So how do we, like I said, so if I don't have a partner, it's easy if you have a partner or you live with somebody at home, right? But if you live alone and you never really realize, oh, I just am probably not getting enough sleep because I'm stressed, or, you don't count into, because you don't immediately think, oh, I have sleep apnea.
Yeah.
It's not something that it's known, like people we don't know.
It doesn't pop up immediately.
Yeah.
So should I just go to the doctor and say, Doc, I haven't been sleeping, I'm not entirely sure why, so how can I approach this as, hey, maybe I have sleep apnea, but without the, I have sleep apnea kind of thing.
Yeah, so it's usually the first telling sign is excessive daytime sleepiness. You get tired in the morning for no reason. Sometimes, just imagine when when we used to be traveling before the pandemic, everyone feels jet lag 1 or 2 days after they came back from a long trip. So usually get better after a few days of rest.
Right.
But sleep apnea, despite resting or despite going to sleep on a daily basis, they still feel excessively tired in the morning. So that's number one. Number two, while sitting in a public space or in their own space, they just finally go to sleep without any reason. Yeah.
Oh, okay.
So usually for men, whenever like they're watching television, or women, when they are just sitting quietly at home, they just doze off like that. So that is actually a sign of excessive sleepiness. They go to sleep in an open space. So that is another telling sign.
Right.
So number three is usually you need a partner. You need your bed partner to tell you that you've been snoring on a daily basis. So if you've been snoring for continuously more than 10 days, that's not normal. So it's time for you to actually come and to see us for us to actually do this test. So the test can actually be done in the hospital, but we can also order the test to be done in the safety or in the comfort of your home. So this test requires some wires to be attached to your fingers, some wires to be attached on your chest, and then they will record the oxygen level, the loudness of the snore, the heart rate and the blood pressure, which then be recorded overnight, and then the report will then be emailed over to us for us to actually interpret them.
Right.
So the test can be done at home accurately. So then depending on the test, we will know whether it's severe or not severe. So for those who are severe enough, so there are many options of treatment. Number one is the use of a CPAP machine, is a breathing machine.
Okay.
Something that delivers pressure into your mouth,
Yep.
that open up the airway that's actually blocked. So that is actually quite easy. It gives an immediate relief, but you have to use this machine on a daily basis, at least 4 hours in a day. So that is the first option, the use of a CPAP machine. Number two, you can undergo surgery to actually have it corrected. For example, enlarged tonsil, which will need to be assessed by the ENT doctor. So in our hospital, one of my colleagues is actually an expert in the surgery of the upper airway. So surgery is another option, but it has to be carefully selected. Number three, you can actually use what we call a mandibular advanced device. It's like you need to go to see a dentist or a specialized dentist that will actually create like a denture for them to actually protrude your tongue, protrude your chin forward, which in a way can actually cause strain on the muscle of your cheek. So therefore is selected carefully.
Okay.
And lastly, another interesting option is to undergo weight loss surgery. Yeah, so weight loss surgery will make you lose weight.
Like a gastric bypass?
Yeah, it's like a gastric bypass. You actually cut 80% of your stomach, make it smaller. So, which then lead to gradual decline in body weight. So, so you have what we call a short-term solution, a long-term solution. Essentially, you need to lose weight because for every 10% reduction in your body weight, you have 50% improvement of your sleep apnea.
Oh, that's actually very, very interesting.
Yeah.
But doctor, like you mentioned as well, snoring, constant snoring is also not healthy. It's something, but we all know, like people usually have the perception that snoring is actually normal when you sleep.
Yeah.
But how you mentioned constant snoring is not actually normal.
Yeah.
But there are people who actually go through it on a daily basis where they don't realize it. So what are the best ways or the best efforts that you see that how you can portray the risk of sleep apnea and about sleep apnea to people out there?
Yeah. So for us, snoring is not 100% means that you have sleep apnea. So some people, when they're extremely tired, they do actually snore. Yeah.
I will test to that. When
Yeah,
I'm really, really
so-
tired, I'll like snore. That's no, I had a long day. Yeah.
And then,
My mom has claimed that I snore sometimes.
Right?
and then ask doctors, because we have to work around the clock and we have to on call 24 hours a day. When I was younger, doctor at times. So even now, because of on call duties, we get tired when we come back after a long shift. So you do snore. But snoring associated with tiredness in the morning, associated with morning headache, with high blood pressure. So this is not normal. So when you snore, but you do not have excessive daytime sleepiness, your blood pressure is not excessively elevated, you don't have irregular heartbeat when you sleep. You don't feel that you are being choked, or your bed partner says that as if someone is actually strangling you when you sleep. So these are pointers that make us think of sleep apnea rather than habitual snoring. So habitual snoring is basically snoring in excessively tired people, which is completely normal. But snoring with the other parameters will actually make us think of sleep apnea.
Right. So very, very interesting. So I'm going to point to our last question before we have to let you go. Because I know you're on call today to rush on back to the hospital. So for going back to the treatment, are the treatments different based on the individual, or is it the same? Do you offer the same option to everyone? So what I'm asking is that if I was a child, do I get the same recommendation if I'm an adult versus an adult coming to you for a consultation and for treatment?
Yeah, so that's the beauty of medicine, because not one size fits all. So whenever any patient comes to see us, we actually have to assess whether they're suitable for option A, option B, or option C. So some people they prefer to use the machine, but after the trial of this machine, they find it difficult to tolerate. Then they will then be subjected to undergo assessment for surgery. So we always try option A. If it doesn't work, we try option B. If it doesn't work, then we try option C. So the point I'm trying to make is every patient is different, just like every child is unique. So every patient is unique. So the treatment option for them should be custom-made and tailored based on discussion between the doctors and the patient. I think nowadays we move towards the empowerment of patients, just like, empowerment of women. So we doctors, we empower our patient. That long gone are the days where, as doctors, we decide everything for our patients. So now when a decision is being made, we lay down the options for the patient, and they need to make an informed decision. So we need to educate them. So we tell them, you try this. If it doesn't work, we can actually try option B. If it doesn't work, then we got option C. If it doesn't work, then we got option D. So custom made, because every patient is unique. So communication between doctors and patient is of paramount importance. And at the end of the day, patient has the right to choose or refuse the treatment that has been offered to them.
Right. I love it. I love it. We ended it on a very, very strong note. And wherever your son is in the audience behind the camera, congratulations on getting better sleep, and congratulations on the success of his surgery.
Yeah.
So again, thank you so much, doctor, for coming on the show. Last word before we let you go to our audiences, the 7 million people who are undiagnosed right now, who are watching and are thinking, maybe I have sleep apnea, what should I do? Can you say last words to them, encourage them to go and just get it checked, just in case?
Yeah, so we have this questionnaire known as STOPBANG, STOPBANG. So S stands for snoring, T stands for tiredness, O stands for obesity, P stands for pressure or blood pressure, B stands for your BMI, A stands for age, N stands for neck circumference. I think it's been portrayed in the screen. G stands for gender. So if you snore, you feel tired excessively, if you are obese, where your BMI is more than 30, P, when your blood pressure is excessively high, your age is more than 50 years old, the neck circumference is more than 17 inch for men, 16 for women, and you are male, because 80% of sleep apnea happens more common in men than that in women. But we do see pregnant ladies suffering from sleep apnea, but thankfully after delivery the sleep apnea goes away. So my last message is that whenever you feel excessively tired, you doze off, you find it difficult when you're driving, you fall asleep, so that's something dangerous. So get yourself treated, come to see us in any of the medical clinic. We will assess you based on this questionnaire, and then we will then order the sleep test that can actually be done in your house, and then we'll see you after the test is done. If it fulfills the criteria for treatment, and the treatment can actually be discussed about what the options best suited for you.
Well, there you have it, ladies and gentlemen. Of course, sometimes, like Doctor mentioned, sometimes you just feel tired. Sometimes you had a long day, like we going on all the events and everything. We've had those days. But if it's constantly happening, you constantly feel tired, you constantly snore, you know, do get yourself checked, as how you guys saw the questions as well. Ask yourself those questions, and if you would need to go for a consultation or would need further treatments for that. But thank you so much, doctor. Thank you so much for being here with us on a Sunday, and you're going to the hospital after this.
Yeah, because I got 3 patients in the ward, and I have to actually come and see them again, you know, before 2 o'clock.
Well, you'll be the best dressed doctor there.
We're gonna let you go. Thank you so much, doctor, again for coming on the show. To those of you who are watching right now, stop bang. Okay, that's all I remembered. Stop bang. Go and look up the questionnaire and go and answer it right now. 7 million people. Okay, that's insane. That's what.
Not counting the ones who don't know about.
Yeah, not counting the ones that no. Those are the ones that don't know.
Oh, don't know. Sorry.
The one yang know.
Well,
I wish you the best, my friend.